Welcome. In today's session, we'll be covering the Allen's Cognitive Level Screening Tool, which is also known as the ACLS. While mainly focusing on the 5th edition, which is also known as the ACLS 5, we will be covering the topics of what the ACLS 5 is, how it is applied, applications and results, findings and reliability.
The ACLS is an assessment tool that represents a sewing-like task. It consists of a leather rectangle with holes around the border, large eye-blunt sewing needle, 2 brass threading locking needles, 1 leather lace with 2 distinguishing sides, and 1 wax linen thread. The purpose of this assessment tool is to provide a quick estimate of an individual's learning and problem-solving abilities during performance of 3 visual motor tasks of increasing complexity. This task consists of 3 different stitches: the running stitch, which is the least difficult of the 3, the whip stitch, which holds a medium difficulty, and the last being the Cordovan stitch, being the most difficult of the 3. The ACLS was originally used for adults with psychiatric disorders, dementia, traumatic brain injury, and strokes, but has since been applied to both adolescents and adults with psychiatric disorders. The ACLS is useful because it looks at how cognitive abilities affect daily life, and it seeks to identify ways to compensate for lost skills.
The ACLS 5 is applied by using verbal directions, demonstrations, and cueing to encourage the individual to stay focused and complete the task. A demonstration of the stitch will be given while at the same time the administrator will give verbal directions on how to do it. This is applied over all 3 stitches. This is an example of the running stitch. This is an example of the whip stitch. And this is an example of the Cordovan stitch.
In regards to the clinical application of the ACLS 5, it is intended to be a quick administration in order to detect suspected cognitive impairments and can provide an estimate of the severity of a problem. Screen scores can be obtained from the tool, which can be used as a guideline to explore further assessment tools and interventions. In order to maximize the potential of the client and ensure the results obtained are accurate, the environment in which it is administered should be a space with adequate lighting whilst having minimal distractions in order to gain the client's full attention. The client should also feel comfortable in the space to reduce anxiety or nervousness, which may also affect the results. If the client actively participates and the environment is to a safe, professional standard, it is suggested that a therapist can gain an understanding of the structural capacities of the brain and what a person perceives or pays attention to. Motor and verbal behavior outputs, as well as a person's values and interests that motivate for performance, can also be taken into account by the therapist.
The ACLS has been a part of occupational therapy for over 40 years now. This assessment was developed by Claudia K. Allen along with her colleagues. It was first published in 1985 and has been modified several times since. It has been evolved over the years due to advances in scientific understanding of mental disorders. There have been many publications of different versions of the ACLS. The assessment tool comes in both a Japanese and a Spanish version. A disposable version of the tool is also available for individuals where infection control precautions must be observed. Pros and cons of the assessment tool. Positives of the ACLS 5 includes a relatively quick time to administer, can be administered to both adolescents and adults. Tool is client-centered and provides the therapist with an understanding of the client's best way to function, which can aid in participation and meaningful occupations. Cons of the assessment tool includes therapists require experience in cognitive impairment to administer the tool, and test results may fluctuate depending on internal and external variables which have had a negative impact on the consistency of the test. The ACLS does require the use of both hands as well as good visual and hearing abilities. If someone has impairments in any of these areas, the ACLS is not appropriate to use.
When assessing the portability of the ACLS 5, it is evident that the tool does have potential to be transferred and applied to different populations and contexts. As previously mentioned, the ACLS-5 has progressed from being a tool just for older adult clients to now also being able to assess adolescent clients. Mental health will always be a prevalent issue in today's society, and the ACLS-5 has shown that it has the potential to expand to different health contexts. The assessment tool's psychometric properties have proven the tool to be relevant, reliable, and valid. This has been done through a number of different studies along with the collaboration of experts and stakeholders who reviewed and contributed to the ACLS-5. Furthermore, the validity and reliability of the ACLS-5 indicates that this tool provides consistent results and portrays concurrent, construct, content, and face validity.
The ACLS-5 is a reliable assessment tool which measures cognitive impairments in both adults and adolescents. It has been used by occupational therapists for many years in order to understand the client's conditions and clients themselves. The tool uses a client-centered approach which can lead to an increase of participation in occupation. We hope that this assessment tool is used in your future practices as occupational therapists, as it is a relevant, reliable, and valid assessment tool for cognitive impairments. Thank you.